ransomware attack on one company may have compromised the data of dozens of others, including some right here in Northeast Ohio.
Texas-based CaptureRx says it was breached back in February and one of its clients was impacted. That client is the MetroHealth system.
News 5's Jordan Vandenberg goes in depth tonight on what data was compromised and the next steps people should take. Jordan.
Patients of MetroHealth should have started receiving these letters earlier this week, notifying them that their data may have been compromised. That data includes their dates of birth, their first name, their last name, even the prescriptions that they use. And cybersecurity experts warn that, unfortunately, these types of ransomware attacks are growing all too common.
Ransomware, malware, software. Our ever-connected world provides ample opportunity for nameless, faceless criminals. The companies that you use aren't the only ones at risk, but also the companies that they use.
So now, you're not just relying on the company you're dealing with, at the hospital, the organization. You're relying on their vendor selection, the services that they use, the companies they use, et cetera. And it really creates a much larger attack surface and a lot more opportunities.
That's precisely what happened to MetroHealth. CaptureRx, a vendor for MetroHealth, boasts about their commitment to protecting customer data. However, in mid-February, it was hit with a ransomware attack that took nearly 2 weeks to confirm. At the end of March, CaptureRx says it began notifying clients, which include dozens of hospital systems and pharmacies nationwide, including Metro. In late May, the company started sending out letters notifying patients that their data had been compromised, including names, dates of birth, and prescriptions. It took more than 3 months from breach to patient notification.
It really is much different than having your bank account data stolen or your credit card data stolen. That's obviously very impactful. You don't want that to happen, but it's much different. The personal details. You start talking about, what if somebody accesses your text messages or your medical history or the things that are much more private to us than a 16-digit credit card number, and it really can be life-changing.
Alex Hammerstone, a leading expert in cybersecurity that lives in Strongsville, says having your health data compromised in a breach doesn't come with the same kind of recourse that other kinds of breaches offer.
When you share that data with somebody else, it's only as secure as they keep it.
Preventative measures are also limited, and that's because, unlike your bank account, for example, customers don't control their health data and how it's protected.
Health data is actually a lot more valuable than credit card data. And one of the reasons is because it's used in fraud. So, it allows, fraudulent organizations to create profiles and then bill insurance companies or the government, whomever, and get paid on it.
It is unclear just how many patients of the MetroHealth system were impacted by this data breach at CaptureRx. However, they did say that the ransomware did not affect their personal systems, nor did it impact patient care. Live in Cleveland, Jordan Vandenberg, News 5.
All right, Jordan, thank you very much. Now, also on the list of dozens of hospitals and pharmacies impacted by this breach, Discount Drug Mart, Giant Eagle, Meijer, and Rite Aid.
So what if your information was included in this breach? There are a couple of options. Under U.S. law, a consumer is entitled to a free credit report each year from each one of the 3 major credit reporting bureaus. Consumers also have the right to place what's called a fraud alert on their credit file at no cost. If you're a victim of identity theft, that fraud alert can span 7 years. Consumers can also place a freeze on their credit report, which is designed to prevent new credit cards, loans, and other services from being opened in your name.